Right, okay. Now, for many women, we will see that they will come to a gynecologist after they're married, when they get pregnant. How important is it for also young girls to visit a gynecologist before they get married to, you know, rule out any future challenges they may be having?
I wish that was the norm rather than the exception. We would very much like patients to come in for pre-pregnancy counseling. There's an element of intermarriages in our society, congenital abnormalities, for example, thalassemia. These are things that we can screen for. These are things we can test for.
Right.
There are tests now available whereby we can do genetic studies for both the patients and find out what the risk factors are, especially when they're first cousins. So if they come in for prenatal visits before they get pregnant, then we can really take their health to a better level. For example, we can do rubella testing. Right? If the patient is not being vaccinated against rubella, we can vaccinate her before she is pregnant. But if we find out that she is not vaccinated, well, when she is pregnant, we can't vaccinate her. And then she's at risk of rubella, and that's German measles. If she gets it in the first 3 months, often the fetus is severely affected and we have to terminate the pregnancy. That's how important this visit can be. But unfortunately, that doesn't happen.
And it's not something that is so hard to achieve. I mean, all the people who are watching the program right now, this is such important advice that Dr. Tehmina is giving, that, you know, if your daughter, your sister, or somebody, yourself, you're getting married, you must go and see a doctor just to have, you know, a clear canvas in front of you, because when you want to start a family, you would want to be in the best of health and want to, you know, address any issues as preventive measures. So that's absolutely, you know, great advice there.